My goal out of doing a fellowship is to really be comfortable. Since I'm just starting out, I don't know where I plan to be after this. And I want to be able to make that decision based on what I enjoy and is going to let me go where I want to go and do what I want to do.
In any part of a good program, in my opinion, is the sense of togetherness and the sense of teamwork. You know, for every place that I've looked, I always look to see how well people worked together, and that's what I saw here at the University of Minnesota.
Now, every place I've ever gone, I've always heard that story. I've heard that, oh, everybody's collegial. Well, it's not always true. Not every place is strongly collegial. But I will tell you that this place truly is.
So I think because of that, you have the added benefit that you can learn from other people's experience.
There's some of the people that are on the cutting edge of how they're thinking about some of these diseases and technologies, and so you're getting exposed to not only what their new ideas are, but maybe even how they're starting to formulate those thoughts. I think that's important exposure to just kind of be soaking in, and if you're lucky, participating in as well.
So at the University of Minnesota Movement Disorder Fellowship, we accept 2 fellows per year, and it's a 2-year fellowship.
So during my first year, I was at a couple different sites, the main one being the Clinic and Surgery Center, and then you spend Tuesdays at the Veterans Affairs Hospital. About once a month, you go over to the county hospital, Hennepin County Medical Center, and work on the Huntington's Clinic. And then you also have an opportunity to work with some of the other movement attendings at the community centers that are through mHealth. So right now we have a Maple Grove and a Woodbury location.
You can also see other specialties that also care for our patients. For example, a lot of Parkinson's patients also have sleep disorders, so we rotate through with a sleep specialist as well.
I think that seeing these different populations, again, builds confidence and flexibility for your career down the road. I would be really genuinely surprised if I run into a patient population that doesn't feel somehow familiar. Another thing that drew me to this program is that if you're going to learn to do deep brain stimulation, this is really the place to do it.
From the beginning, we are involved in the DBS workup as to whether or not this patient is a candidate.
The fellows are in charge of deep brain stimulation consensus meetings, where they present a patient that has gone through the DBS workup.
And then if they are decided to be a candidate for the surgery, then we also have the experience here again from the beginning to be in the operating room.
Here we do the intra-op monitoring, electrophysiology studies to place our deep brain stimulation leads. Other locations do it with MRI guidance or just based on imaging. And coming here, I didn't realize why that was going to be important, but having been here, I see that it really lets us have the best outcomes for our patients.
After the DBS is placed, we are very heavily involved with the initial programming and then the further fine-tuning of the programming of the device.
Having exposure to all 3 manufacturers has really been excellent. I feel more than proficient in all 3 devices.
And to see different aspects of all of these things that come together, which when we do a DBS consensus to determine if the patient is a candidate, then it's multidisciplinary. And now I can talk from my point of view as a neurologist, but I also understand what the neuropsychologist is saying. And I also understand a little bit of what the surgeon is saying when they say people are or are not a candidate.
So that's one aspect of movement disorders that a fellow will learn here and should know. And then also administering Botox, being able to evaluate patients that would be good candidates for Botox treatments. We'll also work with the ultrasound machine as well as the EMG machine to be able to administer the Botox, to really localize which muscles we want to inject to treat the symptom.
So I think one of the benefits of being here in Minneapolis is being associated with the University of Minnesota is just that because that we are in the location we are in, there's a lot of different avenues you can go down. And whether your focus be research, education, more of the clinical side, more of the procedural side, we have programs in one way or the other aligning with each one of those interests. If I wanted to, I could go set up my own department, start from scratch. And I think that that's something that is attainable through our program.
And I couldn't be prouder of this group. I would put this movement disorders division next to any movement disorders division in the country.